Hi, my name's Angus Taylor and welcome to today's Tech Talk. I'm absolutely delighted to be here today with Professor Fiona Stanley to talk about how we can better use data to solve some of our biggest policy issues. Now, Fiona, you've been involved in a fascinating project in Western Australia called the Development Pathways Project. Can you tell us a bit about the project and the sort of benefits you think it is delivering and it can deliver in the future as well?
Yes, I'm delighted to. This is a whole of government collaboration between groups of researchers who are passionate about finding out how children develop over time and the government agencies whose data we have. So it's not just health, it includes health, education, disability, child protection, public housing, police, justice and corrective services. We can actually map how children from before birth are going to end up in corrective services. We can show how important it is to prevent things very early, and it shows how joined up many of these big problems are as children move through their lives. The value of this is its total population data. Now, when you do surveys and studies, what happens is you get a biased response rate. This is everybody. So you can say, you know, what the cost effectiveness is of interventions and services, who gets it, who doesn't, what are the risks and characteristics of the people who do well under such services and who doesn't do well.
So in practice that means we can test whether things governments are doing actually work.
Absolutely, and you can cost that out. And people like the police have been very keen for us to map hotspots of potential problems and crime and substance abuse so that they can map their services against them. So it's got a predictive value as well. We're interested in it as researchers because we're very interested in why children don't develop well and what are their risks and preventive characteristics. There's a wonderful example of the best outcome for education. It's not a lot to do with schools. It's to do with where you live, how old your mum was, whether she was married, what her social class was, and what capacity she had to nurture you in the early years.
And we can see then the impact of that beyond just their school life?
Absolutely.
Are we seeing results from...
Well, these children now in our Developmental Pathways project, it's a total birth cohorts, are now 35. Right. We're even able to look at their own parenting now. We have intergenerational data. Right. So this has been a research project, but the wonderful thing that's happened is, this is now 11 years old. Initially, the bureaucrats and the policy makers were quite scared about data. They didn't have the analytical capacity. They were very excited about the possibility of joining up these data sets. What's happened is that they've realised the value of the data. They've actually started to get more competent and to think about why joined up data is so valuable. The thing that's driven it has been both the passionate users and the consumers. They are extremely keen that we use this information to improve the service delivery, not just in health, but in other services. And that's really turned it around in Western Australia.
Yeah. So if you look more generally across the health research community, how important is getting access to data for that research community?
It's crucial. And I think if you do any surveys or studies where you can't get total population data, you'll get the wrong results. One day coffee's good for you, the next day coffee's bad for you. Unless you get the whole population, the people who aren't in randomised controlled trials are people who often are the ones you really want to study. The smokers, the substance abusers, the comorbidities and so on. And so to get that total population data is absolutely key to get accuracy in what you're doing in the health system.
And so what sort of benefits can we see, have we seen and can we expect to see in the future from getting access to this data for researchers?
There's been a huge number, and I think we were able to confirm aeroplane travel and vascular disease in the legs. That led to implementation of preventive projects.
So that came out of work that had been done from population data?
Yes.
Wow, yes. So the DVT...
Yes, absolutely. And so we've had a large number of projects looking at things like evaluating public housing for people with mental illness, whether that's effective or not. We've been able to look at the contribution of ADHD kids to incarceration and looked at the ways to improve that. We've been able to look at fetal alcohol syndrome and how that's contributing, not just in Aboriginal children, to children in detention and so on. So there's a huge number of ways that we can use these data, but the most exciting one that we haven't been able to do is the linkage of the pharmaceutical data to all of the health data.
And so what would that do for us if we could get that linkage?
We would be able to say, like that, whether a drug had an adverse effect. We'll be able to look at whether doctors were prescribing accurately. We'd be able to look at harmful effects of all interventions, not just drugs, and that would mean a huge cost saving for the nation, because so many drugs...
And also better outcomes, presumably.
Better outcomes for people. We wouldn't be killing them.
Yeah.
We wouldn't make them sick.
Yeah.
We'd actually have a much greater ability to look at cost effectiveness of that whole system, and it's really anguishing to me that we don't have that system in place.
So what's holding us back? What do we need to do to get more access to this data to solve the sorts of problems you described?
Well, this is what's so exciting about what your government has done in terms of opening these data sets. We were unable to get Commonwealth data. We could get the state data, and we were hungry to link in not just the pharmaceutical data, but the Medicare data. To have that for the whole nation means that you would have everybody monitored over time, trends in outcomes, whether services were effective, who was not responding to therapy, who was getting inappropriate investigations. The cost effectiveness that would be enormous. If you could scale that up to the nation, it would be a most innovative use of the data that you've been collecting for a long time and not used appropriately.
So with access to that data, how would you expect the health sector and health services to change over the next 5 or 10 years?
There's some radical changes that would happen, because what would happen is that there would be a real evidence base on which you make your decisions. And you could almost imagine that there would be some ways in which you could control that to ensure that people were doing it. Everyone's always talking about evidence-based medicine, but very few people are actually doing it. So that's one thing that could happen. Once we get electronic health records, not only will patient care improve, but we as epidemiologists and public health researchers will be able to give you the very best evidence on what you can do to prevent these problems, because that's where you're going to get your biggest bang for your buck. And at the moment, we're stopped from doing that.
So better targeted spending, and that spending getting better outcomes.
Absolutely. And getting people in the health sector and in the other areas of child protection, education and so on, to also have an evidence base, to know what they're doing is not harming people, and to know what they're doing is actually being good for the community. And I think that's the most exciting way that you could use these data for the future.
Well, that's fantastic. Thank you very much for your time today, Professor Stanley.
Thank you, Angus.